Jani, blood pressure control, presence of depressive symptoms, and clinical outcomes after 4 years in patients with cardiometabolic disease.
Good afternoon, everyone. My name is... should I wait for the slides? Forward, okay. Good afternoon, everyone. My name is Bhautesh Jani. I'm a primary care physician based in Glasgow, Scotland, and I also do research with the University of Glasgow. The main finding of the study which we did in Greater Glasgow area was that if you have depressive symptoms and extremes of blood pressure, they predict the highest rates of harmful cardiovascular events in patients who have got existing heart disease, diabetes, or stroke. The context of this study is that patients who have got existing heart disease, diabetes, or stroke are more likely to have another heart attack or another stroke or die due to heart problems than the general population. In particular, those who have extremes of blood pressure or those who have depressive symptoms are at higher risk, which has been shown by previous evidence. What is unknown, relatively unknown, is the combined effect of having extremes of blood pressure and depressive symptoms together, and our study tried to address that problem. So, this was a community-based study in Greater Glasgow area. We had more than 35,000 patients with existing heart disease, diabetes, or stroke. The study started in 2008-09, and we assessed their depressive symptoms using the hospital anxiety and depression score. I have to underline that this is a data collected from routine clinical practice. It was not a research study. The blood pressure was also recorded at the same time, and the two blood pressure were categorized into 5 different categories to help with understand the clinical implications of the findings. So I had very high blood pressure, a reference category, tightly controlled, and low blood pressure. With the help of electronic data linkage, we studied patients getting admitted with another stroke or heart attack or heart failure or dying due to heart disease over 4 years of follow-up. So more than 10% of the patients in our study had at least one major cardiovascular event, as I explained before, and depressive symptoms compounded the risk at extremes of systolic blood pressure. If you look at the figure here, this shows the relative risk with the reference being having a reference systolic blood pressure and having no depressive symptoms. So this is a risk in relation to the reference category. So at the top, you've got patients who only have low systolic blood pressure, followed by high systolic blood pressure or depressive symptoms. The top 3 bars are 3 conditions occurring in isolation. Then, if you look at the 4th line, it's the combination of low systolic blood pressure and depressive symptoms. They had 36% higher risk of having a major harmful cardiovascular event. And the last one with the highest risk was those who had very high systolic blood pressure and depressive symptoms together. They had 83% higher risk of having another cardiovascular event in the 4 years of follow-up. These results were adjusted for age, sex, body mass index, total cholesterol levels, patient's socioeconomic status, and use of antidepressants, and the number of existing medical conditions they had. So the key implications I would suggest are for secondary prevention. We need to perhaps focus our resources on monitoring blood pressure in patients who got depressive symptoms and extremes of blood pressure together. In this group, we also probably, I have to underline, this is not a randomized controlled trial, so we don't know if screening for depression in patients who got extreme blood pressure is going to be of any benefit, but that's another line of inquiry which we need to think about. Of course, we need to do more study about understanding the relationship between depression and blood pressure, especially in patients with existing heart disease, diabetes, and stroke. Thank you for your time.